Today I would like to brief regarding stroke. Stroke is treatable and stroke is preventable. Stroke occurs due to lack of the blood supply to the brain. There are mainly two causes for the stroke. One is the ischemic stroke and other is the hemorrhagic stroke. Ischemic stroke occurs due to the lack of the blood supply to the brain, and hemorrhagic stroke occurs due to the rupture of the blood vessel within the brain. Stroke patients usually presents with sudden onset of the weakness of the one side of the body, difficulty in understanding, difficulty in speaking, or there may be a deviation of the angle of the mouth. Sometimes in the brain stem stroke, patients may have the giddiness, lack of coordination, breathlessness, difficulty in swallowing, and in the major stroke, the patient may land up in unconscious state or may land up in the coma. So stroke is treatable and stroke is preventable if we treat appropriately during the golden hours. Whenever there is a lack of the blood supply to the brain cells will be deprived of the oxygen and nutrients, and slowly the brain cells will start dying. During these golden hours, if we treat appropriately and if we are able to establish the blood supply to the brain, then whatever the weakness or the hemiplegia will be reverted back, and thereby we can prevent the major morbidity and mortality. So during this stroke, I would like to highlight that the patient should immediately rush to a hospital or a setup where there is a proper stroke unit consisting of the stroke physician and endovascular neurosurgeon, and where the hospital have a facility of CT, MRI and the cath lab. Cath lab is the place where we will do the brain angiogram, and thereby we can detect the stroke and we can treat it appropriately. So usually if the patient comes to the hospital in the golden hours to the appropriate setup like Aster CMI Hospital, there we will do the brain angiogram and we will detect what is the exact cause for the occlusion of the blood vessel. In the golden hours, we will give the clot buster injections so that it can open the blood vessels, and nowadays with the recent latest technology, we will do the brain angiogram, and during the same time we will do the mechanical thrombectomy, which is a minimally invasive procedure where we will remove the clot or the thrombi obstructing the blood vessel so that the blood circulation is immediately established to the brain, and the patients will start improving on table immediately after the procedures. There are so many cases where the patients were completely recovered and has been discharged within 24 to 48 hours. During this COVID pandemic, we at the Aster CMI Hospital treat the stroke patients in the golden hours by doing the appropriate measures, and we will not wait for the COVID report, and thereby it will make a good result to the patient.